Welcome back to Ethnic Health America, our series on legends in medicine. In this segment, we're going to talk to Dr. Robert Mines. For over 40 years, Dr. Mines practiced pediatrics in the Oakland, San Francisco Bay Area. Dr. Mines, welcome to our program.
Well, thank you for having me, Dr. Nora.
Tell us about your journey to medicine.
I have wanted to be a medical doctor all of my life. I spent all of high school and junior high school preparing to enter medicine. Probably one of the greatest influences on me was my family physician. In fact, I was the first baby that he delivered after he finished medical school. And we had a very close relationship. He followed my career with great interest. But I used to go on house calls with him when such things were done. And he was an overwhelming influence on.
Now, you came out of the city of Philadelphia. Even though it was kind of an eastern city, opportunities for African Americans in medicine weren't all over the place, were they?
At the time I was in Philadelphia, no. There were 5 medical schools in Philadelphia and the College of Osteopathy, Philadelphia College of Osteopathy. And at the time I was there, I was a pharmacy student at Temple. Temple had 3 black medical students. University of Pennsylvania had 1 black medical students. I can tell you about those 2. I don't know exactly what was going on with Jefferson and Women's Hospital or the College of Osteopathy, but there were not very many opportunities at all for African Americans.
So how did you move to medical school? Where did you attend? How did that all happen? And how did you get to pediatrics?
Okay, pediatrics I found extremely interesting. Number one, we had a growing and developing subject, and that just fascinated me. Also, there were not many people who were interested in pediatric medicine at the time, but I found it to be fascinating. And I had another mentor, Dr. Perry Crump, in medical school, who was quite influential on my decision. But I wanted to do pediatrics probably from the time I entered medical school.
And after a period in the service, as I understand it, you chose to come to California. What was different about the health of children then as opposed to the health of children now?
Oh, it's different. There's a remarkable difference. Number one, the diseases for which you're immunizing children now, polio, whooping cough, diphtheria, these diseases happened. I can remember as a second-year pharmacy student where we closed all the playgrounds in Philadelphia because of polio epidemic. We had no vaccine. Now, these things are unheard of in Western civilization. We still see some polio in some third world countries.
Russia and,
right.
And one of the kind of eastern areas of the old Russia, Tajikistan, but 99.9% of children in the world are immunized for polio.
Exactly. So we've seen in my lifetime the eradication of smallpox and almost the eradication of polio. And when I was a resident, H-flu, influenza, meningitis was common. I mean, we had to suspect every child with a fever of having meningitis. This is no longer the case. The diagnosis is almost made now by exclusion.
When you started in your practice, were there certain barriers that you had to overcome either for training or for in getting yourself established in a practice because you were African American?
Oh, yes. Number one, in terms of training, there were very few places. There were very few places where you could receive adequate specialty and subspecialty training. Fortunately, because of my age, I graduated in medical school the year that most of these things were beginning to open up and desegregation was occurring. But for an African American physician to say he wanted to train in obstetrics in a large medical facility was almost unheard of. And this occurred during my time in medicine. We also have seen the number of women in medicine. In my class, there were 6 women, which made up about 6%. And the last time I was at Meharry, I think the medical class was 65% women. So
Yeah.
it's changed. In pediatric medicine, our residents at Children's Hospital, I'm sure we're well over 50% now in terms of, and we're seeing the same thing in obstetric medicine. So there've been, the changes have just been overwhelming.
One of the questions I've always wanted to ask, you know, we always say these children of today, are the children of today that much different from the children when you first started practice, what, 40 years ago?
The children aren't different, but the parents are different. There is no, particularly in the community where I practiced. When I started practice, we had a lot of poor families, but they were families. By the time I had finished my practice, I had a lot of babies of poor, young black women. And that's a trend that has followed. And I often wonder where we're going with that.
What do you say was the most satisfying thing about a career in pediatrics? I mean, what for you kind of stays with you?
Dr. Lenore, there is not a place in Oakland, and this is on a daily basis, where I don't see someone, either a parent or former patient, who remembers me. If I go to Safeway checkout, if I, Safeway manager, every day I see someone that I gave medical care to, or someone's family. And it is quite rewarding. Just last Friday, I saw a young woman and her mother quite unexpectedly, and I talked with them for about an hour.
Have any of your patients followed you into medicine?
Yes, I have had several, and this is quite rewarding to see these young men and women or go along the same journey that I traveled in medicine. It's overwhelming.
Well, certainly I want to thank you for the opportunity to have practiced with you and your associates, and also for the way in which you all have paved the way for those of us who came slightly after you now. I think your service to the community, quality and standards of your practice set a pattern for those of us who came behind. So on behalf of all of those that you've touched and those that you have motivated, I say thank you.
And thank you for having me.
We'll be right back to continue our discussion after this break.